This is Channel 2 News, coverage you can count on.
We have touched more people in our community than we thought we would touch.
REMSA is redesigning community health care. They have created a model program to take the pressure off of emergency rooms and saving millions of dollars. Health Watch tops Channel 2 News at 5:30. Good evening, everyone. I'm Wendy DeMonte. Kristen Remington is off tonight. Thank you for staying with us. So how do you keep those who don't really need emergency care out of the emergency rooms? Well, you give them alternatives. And REMSA is doing just that with innovative programs that could become the model for other communities across the country. Erin Breen has been looking into those programs and what they mean for patients and what they mean really for emergency rooms as well. Erin?
Well, Wendy, when patients with chronic problems like heart disease and COPD are released from the hospital, they have a very high rate of readmission, which is pretty expensive for everyone. So the Center for Medicare and Medicaid is giving out grants to cut back on readmissions, and REMSA has designed some programs that work. To most of us, an ambulance means bad news. But REMSA has come up with a program to send out paramedics, and the patients are always glad to see them. Katrina Travis is a community health paramedic, making scheduled visits on patients like Greg Larson.
How have those headaches been?
Been doing good.
Larson recently had open heart surgery.
They released me after 4 days, and it's kind of scary to come home. You're not surrounded by monitors and nurses.
On the 7th day, his wife called for an ambulance because she knew he didn't look well.
That will be done going on 2 days.
REMSA's nurse hotline was able to determine that he needed care, but not a trip to the emergency room. So the community paramedics went to him.
They don't walk through the door with a thermometer and an aspirin. They come fully equipped. And
Your blood pressure is 128/78.
I took an EKG. They checked my metabolism. The professionals, they assessed whether I really needed to go to the hospital when I didn't.
We're working with patients that have heart conditions or breathing problems and are available to them 24 hours a day, 7 days a week to keep them home, treat them at home.
The Community Paramedics Program is one of 3 programs, including one that can get people to alternative destinations, including primary care, physicians. And they have a nurse hotline.
Have you lost consciousness?
We have provided resources for our community so people know where to go when they're not having an emergency. On our nurse health line, we're receiving approximately 2,000 calls a month.
And it's paying off.
It's proven to be highly successful, reducing by 50% the readmission rates for these folks who really have significant chronic disease.
Which is an overall benefit to the patients and to the community.
It's going to go over the estimate of $10 million saved, which is really a big deal.
That's a deal for the hospitals, it's a deal for the patients, because through that grant, the services are free to the patients. And it's a deal for Medicare and Medicaid, who aren't paying for readmissions to the hospitals that aren't warranted. They've got 1 more year of funding through that grant, and then they're working to make the program permanent. Covering Health Watch, Erin Breen, Channel 2 News.